Hello, my name is Kieran Jones and I'm acupuncturist and herbalist here at the Parani Clinic. Today we're going to talk about Chinese herbal medicine, how we create a formula for a patient, how we mix that formula, and then how to take it as a patient. So I'm sitting in front of our herbal formulary. It's the bottles you see behind me. Each of those bottles contains a different Chinese herb. I have a few hundred different herbs in my pharmacy. And they're each extracted into a 5-to-1 ratio powder. This company, KPC, is based in Taiwan. It's an extremely safe, certified, um, very high quality product. I choose not to source my herbs from mainland China because I'm a little concerned about the safety of that. So I've chosen to use these herbs from Taiwan instead. The Cleveland Clinic, if you're familiar with them, they're a world-renowned integrative medicine clinic and hospital in Cleveland. And they have an integrative clinic within their hospital. They use Chinese herbal medicine, and this is the same product that they chose to use in their pharmacy. So it's extremely high quality, extremely safe. So I wanted to kind of show you how we diagnose in Chinese medicine. It would be a lot to give you the full explanation of how we do that. It's fairly complex, but I have a way of describing our thought process that makes it make a lot of sense for patients. So let's imagine that we are placing you at the center of the circle, right? You're standing in the middle of a large circle, and in each direction is a different way of your body being out of balance. So in this example, we have hot and cold. We have rising and sinking, and this refers to the energy in your body either rising too much, such as in the case of migraine headaches, or sinking too much, as in diarrhea or depression, fatigue, those kinds of things. We also have dry and damp, and then cold and hot. Oh, I'm sorry, in and out. So energy can also be moving either in towards the center or out towards the periphery. And you can think of that such as like excessive sweating is qi moving out too much. Qi moving in too much could be withdrawing in the case of depression. Constipation can be qi moving in too much. Clotting, blood stagnation, those kinds of disorders also. So let's think of a hypothetical patient and put them on this circle. So let's say that somebody comes in with some sinus congestion. Maybe they have recent allergies or they have a cold. So, they have a lot of dampness. So we can usually say that they are probably a little more on the damp side of the spectrum than the dry side of the spectrum. So I'm just going to put a mark on dampness to show how damp they are. So instead of standing right in the middle, they're kind of leaning this direction, but they're not leaning all the way over here. They're kind of in the middle. They're fairly damp. Next, let's say that they have some heat. So if when they expectorate some phlegm, they find that it's yellow or even green. So showing some amount of heat, maybe they have a little bit of a fever, they feel warm to the touch. So those are all things that a Chinese medicine practitioner would say, oh, this patient has heat. We would also look at their tongue and note that it's a little bit more red than it should be, and that their pulse is a little more rapid than we would like. So I'll place this patient on a little bit on the heat side of the spectrum. And then lastly, we also look to the root of these conditions. So it's important to treat the symptom. Obviously, we want our patients to feel better. We want their pain to reduce. We want their discomfort to get better. But it's also very important to look at why those symptoms came up for that patient in the first place. So we want to think about, in this person's sinus congestion, what's behind it? What happened a couple steps up the road that created that symptom? And hypothetically, in this case, let's say that it's a result of qi not rising up enough to the head. So if you have sufficient energy, you can maintain the circulation and move the lymph and move the fluids that prevents that from showing up. You have enough presence of your immune system in your sinuses to reduce the colonization by bacteria or fungus that leads to the sinus congestion. But let's say in this patient, they have an insufficiency of this rising qi, so we could think that their qi is sinking too much. And if that's the case, then we would identify that with some of their symptoms. Maybe they have a history of prolapse, maybe they have loose stool. Maybe they feel a sensation of kind of heaviness, of down bearing of their energy. And we would link all those things with the problem of the chi sinking too much. So let's take a look. This is what we have now for our patient. We have too much heat. We have chi that's sinking a little bit too much. And then we have a little more dampness than neutral. So looking at this, now we think about what herbs exactly balance out these imbalances. So we want to come up with the herb that's exactly as drying as they are damp, right? So all of our Chinese herbs have energetic places on the spectrum. There's herbs that are, very, very hot. There's herbs that are very, very cold. There's herbs that are extremely damp, herbs that are very dry. And there's herbs that are just a little bit dry. So there's also different dosages. So we can use an herb that's very, very hot, but use a small amount of it to add a little bit more heat to a patient's formula. So looking at this, I'm going to choose, start it with a formula, or maybe a few formulas that create a drying effect. So let's try to find the herbal intervention that places emphasis right here, that draws this dampness back towards the center. I'm sorry, this dampness, doing this backwards, back towards the center. So in this case, we're going to use a combination of two formulas. One is called Chen Tong. So this is a mixture of 4 different herbs, and add that to our mixture here. I'm going to be zeroing out my scale and weighing exactly the right amount, but I'm just doing this for demonstration purposes. And the other herb I'm going to use is Song or Sun. So the Chen Tong is drying and used for dampness and phlegm, kind of anywhere in the body. Song or Sun is very specific for clearing the sinuses. So we're using both a general effect that addresses the whole body in this way, and then a very targeted approach that's addressing it directly where the patient's experiencing symptoms. So a little bit of that. Next, let's look at this sinking chi. So here our patient's chi is sinking a little bit too much, so we want to put something in that's going to guide their chi up and bring a little bit more energy to that area. In this case, I'm going to use something called jie geng. So this is an herb that raises the chi and has a real affinity for the lung system, including the sinuses. Add some of that. Next, we'll look at this heat pattern. So patient again is that hot, so we want to find something that's exactly that cold to draw that heat back towards the center and bring that patient to a neutral position. So in this case, we're going to use Banlan Gun. So this is an antimicrobial herb. It's very good when there's an infection going on. Great for the throat and the sinuses. So we're going to add a little bit of this to help bring down some of that heat. Okay, now we're also going to add an herb that creates a protective function. So in somebody that has a lot of dampness in one spot in their body, like up in the sinuses, they could have dampness here, but they could be dry in other areas. So we want to kind of safeguard their body's yin, yin energy being the more moistening, kind of fluid-like energy in the body. So if you create a very drying effect in somebody, it could be that you resolve their symptom here, but you create some other problems in other parts of their body. So in order to safeguard their yin, protect it, keep them from being too dried out, we're going to add an herb Mai Men Dong, which is moistening and dry and protects it from being too dry. So we'll just add a little bit of that. And then lastly, let's say that in addition to the congestion, they're also experiencing, they have a headache, they have pain, from the sinus congestion. And so then we're going to add Tuan Xiong, which is our kind of number 1 go-to headache herb. So when somebody's experiencing a headache, you'll often add this. Wouldn't be enough just to have that, right? Because the cause of their headache also needs to be addressed, which is the sinus congestion. So we have our herbs in our sample formula here, and mix it all up, and then show you how we would take those two. We would go into a bottle for the patient's name, date, and recommended dosage on it. For something like this, like a acute, recent, common cold or sinus congestion, formula would probably be taken for about a week or until symptoms resolve. For something that's a lot more long-standing, like a chronic digestive complaint, insomnia, fatigue, things that have been around for a lot longer, they may be taking their herbs for several months. Sometimes there's a constitutional formula that's just a really good fit for that patient, and maybe they take it off and on for years and years. Whenever they start to feel a little run down, they would add a formula and it just kind of bolsters them. A lot of people have a constitutional nature. Some people are going to tend to get hot, some people tend to get cold, some people tend to have chi that rises, some that sinks. So that tendency can also be addressed with different Chinese herbs. You can create the formula that matches that tendency, and then the patient would just have that formula on hand and would take it whenever things start to kind of go awry for them. So let me show you how to take the herbs next. So let me just grab a cup, excuse me for a moment. So you don't need much water, just a small cup is fine. And then for a formula like this, patient will most likely be taking between 3 and 5 scoops. For our purposes, I'll just put 1 scoop in here since I don't actually have sinus congestion at the moment. So level scoop, there's a spoon like this in the bottle for the patient to take and measure them themselves. This equates to about 1 gram of the herb powder. So that would go into our cup. We've got some hot water here. Just add that in. And then you want to use hot water rather than cold water, just so the herbs dissolve a little better. Mix that up. So the flavor of the herbs can vary quite a bit. Some herbs are a little bit sweet. Those are usually the herbs that are going to be more appropriate constitutional formula. Something that somebody kind of takes on an ongoing basis. It tends to be something that's pretty palatable, pretty tasty. Herbs that are addressing an infection, herbs that have antimicrobial function, herbs that are clearing away something that's acute, those really strong herbs tend to be a lot stronger in flavor. So it's not going to be quite as palatable for that patient. Usually people have a hard time with herbs their first couple doses just because it's very different. We are not used to consuming things that are even slightly bitter in America. But once they have them a couple times, they get used to them. It tends to be pretty easy, and a lot of people actually crave the herbs if they miss a dose. You can either do a small amount of water like this and just shoot it down the way I did, or you could use those herbs and add it to a large amount of water and sip it like tea. I have a lot of patients that do that too. So all great options. I think that's the majority. As far as taking it with food or without food, it depends on the formula and it depends on the patient. Sometimes herbs can cause a little bit of an upset stomach if they're taken on an empty stomach. So in those cases, you'd want to add some food. And also, if you take Chinese herbs and you have any kind of symptoms, any kind of side effects from that, get in and talk to your herbalist about that. Let them know that, I took this and I got a little bit of an upset stomach, or it kept me up at night. Because we have so many different herbs, and each of those herbs has such specific functions, we can really take that formula and just tweak it ever so slightly. You can add a little bit more heat, or you can add something that will help somebody stay asleep. You can just modify that formula to make it just a perfect fit. So those kinds of responses are really valuable information for your herbalist, and you should pass that information on to them. So that's it for herbal medicine. Feel free to leave any questions or comments in the Contact Us link on our website, and I look forward to chatting with you next time.